so I have a question for you.
Ooh, let's see.
So let's assume that, because I see small animals, that I have a neutered dog that comes into the hospital. He's been having 3 days of progressive difficulty breathing. They really rushed him into the hospital. The patient seems to be stable. He's not eating as much. And I tell him we're going to go ahead and give him sub-Q fluids. We're going to give him a dose of enrofloxacin and put him in oxygen until the next day. Does that sound like standard of care?
In that case, Dr. Pard, I think we're going to be thinking that you are a little bit crazy, because that's really not standard of care. And it's incredible how we think that would be appropriate for a rabbit, for example. And I think we are kidding here, but that's a great example. If she were to give this advice to an intern or another colleague or a technician with a dog that came breathing that way with difficulty, giving sub-Q fluids without knowing if that patient has, for example, heart failure, that would be outrageous. You never do it, right?
I would never.
But why do we accept that when it comes to rabbit? It's almost like we turn off our medical brains because we say species that's not a dog or a cat.
Exactly.
So I always tell my colleagues and technicians and students, I say, forget it's a rabbit. Pretend it's a dog. What would you do?